Well, hello, SAD Nation, and welcome to another very exciting episode of our SADDChat series. We're so glad you're here. We're so thrilled that you continue to be the hands and feet of this organization that works to empower teens, engage parents, mobilize communities, and change lives. And I am very excited tonight to introduce you to one of our new friends, one of our newest partners, Ed Ternan, who is the president of Song for Charlie. Ed, thanks so much for having us with you.
Oh, thank you so much, Rick. This is really important to us to get to know the folks here at SADD Nation. This is great.
Well, we're excited to learn more about you and the great work that you've been doing. Can you start off by just telling us a little bit about you and about your incredible organization, Song for Charlie?
Right. My wife, Mary, and I founded Song for Charlie shortly after we lost our youngest son
Hmm.
to a counterfeit prescription pill that he had purchased online. And shortly after Charlie's death, Mary and I realized a couple things. One, that this was happening way more than we ever realized. It's really happening a lot. And as a matter of fact, first responders and emergency room technicians and
Yeah.
campus security people and law enforcement, they knew about it and were really scared about this trend of these counterfeit pills. And yet we saw a real information gap where we asked ourselves, well, who's telling the kids?
Yeah.
So we founded Song for Charlie with the explicit mission of trying to take the warning message about counterfeit prescription pills made of fentanyl, which we named fentapills, as directly to young people as we can, working with schools, going online, and partnering with organizations like yours.
Wow. I mean, from all of us at SAD, we are so sorry for what you and your family have gone through, and just so thankful that you've chosen to turn that adversity into action. So we're so thankful for the work that you're doing. I'm hoping you can tell us a little bit more about these. I think you call them fentanyl pills, right? Why is that issue of a fake pill or these lace pills so critical?
Yeah, we coined the term fentapill to kind of capture in one phrase, one word, uh, this unique problem and differentiate it from the other ones. So you've got the fentanyl epidemic that's happening is kind of a
Yeah,
subset of the opioid crisis. And fentanyl is showing up in all kinds of drugs that young people need to be aware of. In your world, for your audience, mostly cocaine and MDMA. A lot of fentanyl is showing up in that now. But these counterfeit prescription pills that young people grew up being very familiar with and accustomed to, and it's kind of normal in ages 15 to 24
yeah,
to know friends that take prescription pills, to maybe share them. Mom and dad have them in the medicine cabinet. And the problem is that drug traffickers have decided to capitalize on that familiarity, the normalization of pill taking and sharing, to find a really profitable way to meet that demand. And they
yeah.
do it by counterfeiting these pills.
Wow.
So it's gotten to the point, and we've confirmed this from every different angle, that young people today need to assume that if they come across a pill outside of normal channels, say online, or they see it at a party, or athletes pass them around the gym,
Hmm.
you have to assume that that pill is counterfeit. And if it's counterfeit, even if it looks real, it's made of fentanyl, which is an extremely potent opioid, impossible to dose properly. We estimate that we're on pace to have about 5,000 people, Americans, between the ages of 15 and 24, high school and college age, die from these counterfeit prescription pills specifically in the next 12 months if we don't do something to flatten this curve.
Wow, those are scary numbers. And as you talk about this, I know many members of SAD Nation, you're right, they see this on a daily basis, whether it be in their communities, in their schools, and in their families. It really is a critical issue. What message would you have for our SAD students on what they can do to raise awareness and help spread this life-saving message, really, about this public health crisis?
Yes. And the first thing I would say, what gives us hope, Rick, is we believe that these are preventable deaths because most of these victims they're not suffering yet from substance use disorder. A lot of
Yeah,
this is self-medication, and young people are not seeking fentanyl. They're being
yeah.
deceived. They're looking for Xanax or Oxy or Percocet, and they're being giving a fake and told it's the real thing when it's a counterfeit. So it gives us hope. that just by telling young people that these pills are fake, that if you go online to get a pill, it's not what you're looking for, that they'll change that behavior. So we've been privy to some market research that was done by one of our social media partners that indicates young people really do not know about this yet.
Yeah.
37%, many of the young people surveyed didn't know enough about fentanyl to even comment on how dangerous it was. And those that did, 37% rated it about the same risk as like cigarettes. So they really don't understand it, and
Yeah.
be able to mobilize the resources of SADD Nation, who are used to engaging young people in the drug conversation,
Yeah.
is a really powerful thing, because it's a little bit different conversation. It's more of a public health emergency.
Yeah.
It's informative about, beware of these particular drugs, because this is not what you're looking for, and it's
Yeah.
extremely risky.
Well, and it's so risky too because one choice, literally one pill, can
Yeah,
have lethal consequences, and unfortunately, and so this there are no do overs for this.
right.
There are no options to try it again the next time, or learn a lesson.
Yeah,
It's
that's right.
it's really scary, and obviously your family has suffered this tragedy firsthand. What advice would you have for parents and other caring adults, what we oftentimes call adult allies, who are watching today and are thinking about, how do I have a conversation with a young person that I care about this subject? What advice would you have for them?
Yeah, I think that it's important for parents and other caring adults to understand that the conversation about drugs and substance use has changed because of the advent of these very potent synthetics like fentanyl that have come on the market.
Mhm.
And just to
Mhm.
back up one step and say, well, why is this happening? Well, these synthetics don't require, they're not organic, they don't, not plant-based, they don't require a crop or a harvest. So
Mm.
what happens in your old school days of supply and demand, if you can make as much as you need, your cost
Mhm.
goes to zero. So it's an irresistible raw material for drug traffickers. And that's why it's flooding the market of these counterfeit pills and other drugs. As a result, the old narrative about the risk of substance use was kind of, I put it this way, it was kind of described as a journey
Yeah.
where, the warning is, if you engage in this behavior too often or too much, you may one day become dependent and then addicted and potentially accidentally overdose on your drug of choice.
Right.
As opposed to a path now where one day you might get off on the wrong path. The landscape today in the drug world is more like a minefield where your next step could be your last. So it's a completely new kind of risk dynamic going on out there. So it's very important for parents to have very honest conversations about their young people about the risks of self-medication, that there are other organic ways to change your mood, because it's
Mhm.
tough time for kids today with COVID and lockdown and so forth.
Yeah, absolutely.
Many of these deaths now are not necessarily recreational party deaths. It's kind of escaping. It's taking the edge off. It's
Mhm.
chilling out, and unfortunately, one of the highest risk behavior a young person can engage in at the moment is to go in their room and close the door and pop a pill. That used to be kind of a benign behavior, and it's not really associated with the risks of drugs. But that's
Yeah.
how these young people are dying now, at home in their own bedrooms by themselves, just trying to take the edge off. So parents need to be sensitive to how the kids are feeling. These are tough times, self-medication. Talk about other ways to change mood, and really discourage turning to prescription pills unless it comes in a bottle that has two names on it, your kid's name and their doctor's name. And if it doesn't come out of that bottle, you just can't trust it these days.
Yeah, I've been working in prevention long enough to remember, even from days of old, this is your brain on drugs. And this is no longer what we're talking about. Like you're saying, there's this immediate crisis. Like you said, I really appreciate the visual of the minefield, because it's so true. And there are mines all around us.
Mm.
It does make me think of a follow-up question. If you're a parent and you're sitting down to have this conversation, are there a couple talking points that maybe you could give our parents of how to start the conversation, and some of those key pieces that they'll want to mention in that conversation about this new danger?
I think it might be interesting to stress the fact that it's new,
Yeah.
and that it's informational, and that it's not a lecture, but that there is something new on the scene that is very important that you know about, because I didn't face this risk when I was young, but
Hmm.
your generation does. And so we care about you, we love
Yeah.
you, we want to make sure that you don't get caught up in this, because as you said, and as the whole national campaign is rallied around this thing of one pill can kill.
Hmm.
There are no second chances, and you just can't trust these supposedly safe prescription meds, what look like prescription meds, because if they don't come from
Hmm.
your doctor, they really, I mean, the street pills that are seized these days, over 95% of them are counterfeits made of fentanyl. So there are no legitimate pills on the street. And so you start with the fact that son, daughter, these are everywhere, and they're not what you're asking for, right?
Yeah.
And if you have stress or mental health, let's talk about that. Let's make a doctor's appointment. And if you need a prescription for something, that's a different conversation. But to go out on your own and seek a relatively safe solution, what was relatively safe a few years ago is now
Hmm.
extremely risky.
Yeah, I mean, as I've worked with Gen Zers now for a long time, I think we can also stress the fact that I mean they're kind of getting duped, right? They're being lied to by I'll call it an industry, but a mechanism, if you will, that is like you said is out to make profit and doesn't really care about their safety at all.
Yeah, that's right. And it's more dangerous than ever before. And people
Mhm.
who criticize the war on drugs and prevention efforts will say um, that one of the problems was we warned kids that drugs were very, very dangerous, and then they didn't match up with their real life experience. And you know what?
Yeah,
That's changed.
absolutely.
They really are deadly now, and that's just happened in the last 5 or 7 years. And so, that's what the kids are up against.
Obviously, the Song for Charlie is starting a powerful movement to join the chorus of folks who are talking about the urgency of this topic. If folks want to get more involved or learn more about your great organization, how can they do that?
Yeah, thank you. There's a couple of ways. Um, our kind of 3-point plan that we came up with was to try to go to get to young people as directly as we can. And what does that mean? Well, we have to go where they are,
Hmm.
we have to speak their language, and then we have to get them talking to each other. Those
Yeah.
are 3 pillars of our plan. So where are they? Well, they're on social media. So we
Hmm.
have an Instagram, we have a TikTok, we have a Snapchat account, and we are trying to get our message to go viral. So anytime anybody follows us, likes our stuff, shares our stuff, that kicks the algorithm in, gets the message
Yeah.
out there. So just that activity for young people would be a huge help. And in terms of parents, we really would like to get help with parents going to their schools and telling them just how important this is.
Hmm.
And you guys are really good at this. You're way ahead of us in this regard, and we would love to get SADD Nation's support with this.
Yeah.
Our message is really just a snap on to the conversations you're already having. It's
Hmm.
kind of low hanging fruit. We're not
Yeah.
asking for a lot, right? But we ought to enhance the drug education that's happening already with this kind of public health warning that these are
Hmm.
fake and dangerous, and open some doors at the school level, because we think schools have a really important part to play in this
Hmm.
awareness effort. So those are 2 ways.
Yeah, that's really helpful. I think you hit the nail on the head. You really have to meet young people where they are, and we know firsthand how important it is to mobilize passionate advocates who really are the most effective way of creating culture change. I know many of our chapters are gearing up for National Drug and Alcohol Facts Week in March, and I'll give this audience a little teaser. We are partnering with Song for Charlie, and we're going to be releasing some really cool resources. So please make sure that you're staying tuned to the SAD portal, obviously the SAD social media channels, and also our monthly programming guide for more information about that partnership and new resources that are going to be coming your way. Ed, it is such a pleasure to always spend some time together to learn more about the great work that you're doing and to celebrate and to honor your son and to hopefully spread this message together so that we can keep all of our teens and all our communities safe. Thanks so much for joining us.
Thanks very much, Rick. And we're really excited about the partnership. Together, we can save a lot of lives. I'm convinced. Thank you.
Absolutely. Absolutely. Please make sure you check out Song for Charlie on your favorite social media platform. Look for more information from us in the days and weeks ahead. For now, Sad Nation, that's all the time we have. We hope you have a wonderful and safe rest of your day. Thanks so much.